Before I begin, I'd like to say a few words to the families of those we lost in a tragic plane crash in Tehran 1 year ago today. My heart is with you. My thoughts and prayers are with you today and always. We honor the memory of your loved ones, some of them researchers, students, and educators, others newlyweds or families with children. All of them people who contributed in so many ways to the betterment of their communities. We will keep their memory alive through the Scholarship Fund, inspiring the next generation of leaders. This tragedy will never be forgotten. I would now like to take a few moments to speak to the evolving COVID situation in this province. I told Ontarians would ramp up our vaccine rollout, and we have. Yesterday alone, we vaccinated nearly 15,000 people. Ontario has administered more vaccines than any other province in the country. I spoke with the Prime Minister last night about the need for a more reliable vaccine supply to meet our rapidly growing capacity. Every single day, we're getting more and more needles into people's arms and protecting more and more of our frontline healthcare workers, long-term care residents, and most vulnerable. But we're quickly running out. Dr. Kevin Smith at UHN has said he'll exhaust his supply today. Southlake in York Region, the Ottawa Hospital, and others told us they will do the same by the end of the week. All of Ontario will be out of Pfizer vaccines by the end of next week. My friends, we're all hopeful the federal government will get us more vaccines. Without them, hospitals will have to start canceling appointments, and all the progress we've made getting our daily vaccine numbers up will be lost as clinics stand by waiting for vaccines from the feds. Phase 1 of our vaccine plan is well underway, and we're just starting down the road to getting back our normal lives. But we have a long, long way to go before enough vaccines arrive for everyone. Until then, the best and only defense against this terrible enemy are the public health measures. Day after day, we hit new records in cases as hospital capacity is stretched to new limits. But we have to do everything we can right now to save lives. We need people to hunker down right now and stay home. We need you to avoid gatherings with people outside your household. We need you to practice physical distancing when out. Wear a mask and wash your hands often. These simple measures protect you and your loved ones. If these basic measures continue to be ignored, the consequences will be more dire. The shutdown won't end at the end of January, and we will have to look at more extreme measures. In the meantime, more people will get sick, our hospitals will become overwhelmed. So please, I'm asking all Ontarians, please stay home and save lives. Thank you, and God bless the people of Ontario. Now I'll take questions.
We'll go to the phone line for questions. First question, please.
From Laura Stone, Globe and Mail. Please go ahead.
Hi, Laura.
Hi, Premier. Happy New Year.
Happy New Year.
I wanted to ask first about what is going on at St. George Community Care in Toronto. I just want to read the first paragraph of our story today by Karen Howlett in the Globe and Mail. It says, when paramedics responded to a call for help at a nursing home with the largest outbreak of COVID-19 in Ontario, they found their patient naked, alone, ashen-faced, and struggling to breathe. How is this still happening in Ontario? The hospital was called in 4 days after the medical director resigned. Healthcare experts say the government should have intervened earlier and you should require homes to publicly disclose the number of staff working in facilities. Are you going to take more measures? And can you explain to the public why the government can't seem to get a handle on these horrific situations in long-term care?
We're going to take every measure we can. I'm going to pass this over to the Minister of Health. Thank you.
Well, that's a completely unacceptable situation, and we are going to deal with it. We are going to make sure that the hospital is able to provide the care that the residents clearly desperately need. We are making sure that every long-term care home is associated with a hospital who should be able to come in there and provide the services needed. And so we will be dealing with that. We will be speaking with the hospital and speaking with the long-term care home as well to make sure that these residents get the good care that they expect and their families expect and they absolutely deserve.
Follow up?
Thank you. I didn't hear any new measures there, but hopefully there's something that can be done to prevent more of these tragedies.
Yeah.
Premier, you talked in your opening remarks about the vaccine.
Yes.
Can you explain the specific demands that you made of the PM on the call yesterday and how Prime Minister Trudeau responded? Premier Kenney mentioned other jurisdictions receiving more of the vaccine than his province. Is there a dispute over how much provinces are receiving now?
Well, they should be equally split. I know the territories are getting Moderna just because of the situation they have up there. And you know something, I have to tell the people of Ontario, the Prime Minister's working his back off. He's trying his very, very best. He really is. And it's not like they have a couple million doses sitting in a freezer up in Ottawa. By no means. He understands the situation we're all in. We're in desperate need of the vaccines here. If there's one thing, I'm going to ask Health Canada again, please approve AstraZeneca. We're in desperate need of it. Please approve it. It's been approved by other health agencies around the world, and that will really, really help us out. But we have as we say, the machine going. Everyone's ready, and they're doing an incredible job, no matter if it's UHN or Ottawa General or any of the hospitals. As a matter of fact, they're doing great, and we're just waiting for the vaccines. We're in desperate need, so Health Canada, please approve AstraZeneca. And
Next question.
From Christina Canelia at CP24. Please go ahead.
Hi, Christina.
Hi, Premier. Hi, Ministers. I want to follow up on Laura's question.
Sure.
It is so disturbing, that first line of the Globe and Mail article. We have had in this province a unfortunate record number of deaths at Tender Care Living in Scarborough, and it seems that there are no consequences for these homes. I mean, the public reporting in terms of inspectors going into this home, it's publicly reported, those reports, and time again, an inspector goes in, finds issues, puts forward orders, and homes have to return to compliance. But there are no consequences, and the Ontario Long-Term Care Commission, the independent commission, is not looking for consequences. They're looking to make recommendations to you. So when will there be consequences for any of these homes? Because, Premier, you said that there would be an iron ring around these homes, and that's not happening.
Yeah, you know, first of all, it's heartbreaking. This is what I think about constantly. It's heartbreaking. It's frustrating as well with the long-term care homes. We are putting an iron ring. We've required every single healthcare worker, and it's not their fault, but it's coming in through caregivers and healthcare workers to get tested. And I encourage them to get tested twice a week. If we have that down 100%, we'll be able to catch workers that inadvertently are bringing into the homes. Right to the point that we've even put money towards security guards at the front doors to make sure every single person is checked, every single person has have been tested, and it's frustrating is an understatement. And it's with the quicker we can get these vaccines done, the quicker we can get more vaccines from the federal government and into the people's arms. That's how we're going to stop it. We're going to be finished all the long-term care homes and the frontline workers and caregivers by the 21st. And then we're going to start moving forward throughout the Greater Toronto Area and throughout Ontario, making sure every single patient in the long-term care homes are vaccinated. That's ultimately how we're going to stop this.
Follow up?
Thank you. Well, my next question is for Minister Lecce. Minister, yesterday, Dr. Williams and you noted about increased safety enhancements coming to schools.
Yeah.
And we also know that there is a plan for further asymptomatic testing in schools, but you haven't elaborated on any of those plans. And teachers are waiting and wondering, parents are waiting and wondering. So wondering if you could tell us, what are the safety enhancements coming to schools, and how asymptomatic testing is going to be carried out? What regions, how many schools? Because people need details, and you're here today and you're available. Yeah. So I'm asking you to provide those details, please.
Absolutely. We, to date, have followed the expert scientific and medical advice that has allowed schools in this province to reopen uninterrupted from September to December, and millions of children are better off for the hard work of all of us keeping our kids in school, and our commitment is to get them back as soon as it is safe. With that said, you're right. I think the risk profile obviously has arisen in the second wave. We're cognizant.
Health has put out there. They're still gathering outside of family groups. And folks, I just can't stress this enough. When you see the modeling, I think it's coming out Monday or Tuesday, somewhere early, I think it's Tuesday actually, there's going to be a wake-up call, a real wake-up call. And no matter what the federal government, no matter what the provincial government does, municipal governments, if we don't have the cooperation of the people, this is going to get out of hand. I just can't stress it enough. Please, please, just follow the protocols. We're in a desperate situation, and when you see the modeling, you'll fall off your chair. Everything is on the table right now. There will be further measures because this is getting out of control, and we have to do whatever it takes. And again, I know I say it all the time, but everything is on the table right now.
Follow up?
So with things this bad, you always like to say that the people are going to know the numbers, So can you tell us what these modeling numbers are saying? And do you think are you going to put Ontario back into the kind of situation where we were last March, where pretty much everything is shut down?
Well, once you see the modeling, we'll announce that next week. I'll pass this to Dr. Yaffe. Again, folks, this is so serious. Matter of fact, this is the most serious situation we've ever been in, ever, since the beginning of this pandemic. I can't stress this enough. Please follow the protocols that the health units have put forward. I'll pass it to Dr. Yaffe.
Thank you, Premier. Today's numbers are, to be frank, they are scary. The raw number of cases is over 4,000. There are some cases that were from a few days ago that were included, so it's probably around 3,800. But it's very high. It's going the wrong way. We have more and more people hospitalized, more and more people in ICU, more and more people on ventilators. The hospitals are starting to have to cut back on elective surgeries and other very important procedures that require ICU care. They're starting to have to move patients between hospitals, cut off elective procedures, and we have more and more outbreaks in congregate care, particularly long-term care. We have increased rates of infectivity, of positivity, even in children now. Since the middle to the end of December, the percentage of positive children went up dramatically. So what we're seeing is there is more and more spread of this infection in the community. We also have the mutation of the virus. There's the UK variant, B117. We have had 6 cases identified in Ontario. We're doing way more testing to look for it. There's probably more that we don't know about. What we do know about that variant is it is more contagious. It's been shown to be about 56% more contagious between people. So if we get a case, we've been pretty lucky so far as we know, the cases have been in people who recently traveled to the UK or were a close contact of a traveler, and they have maintained their quarantine. We may not be so lucky in the future. There's the South African variant. So we are in a very serious situation. We need to consider all possible measures, to contain this infection. We don't want more people dying. We don't want the ICUs overwhelmed. We don't want morgues overwhelmed. And I know we don't want to scare people, but on the other hand, I think there's too much complacency. And I understand it. We're tired. It's been a long time. You know, people are sick and tired of the whole thing. They may not know anyone who's become ill. But believe me, although it tends to affect more older people, it does affect younger people too. And, you know, everybody's got people in their family. We want to keep people healthy and safe. So please stick to the measures. But I will say, as we look at the modeling, we are going to be, through the public health measures team, with input from the medical officers of health across the province, I think we do need to consider more serious measures, perhaps similar to what happened in the spring, and looking at other jurisdictions, what they have done and what has worked, so that we can get ourselves out of this with the light at the end of the tunnel as we vaccinate more and more people. Thank you.
Next question.
From Kim Leduc at Q104 and Kenora Online. Please go ahead.
Good morning, Premier.
Good morning. How's everyone in Kenora?
Good morning, Premier.
Good morning. I was just saying, how's everyone in Kenora?
Oh, sorry about that. Yeah, we are well. Now, I want to change this up quite a bit. Premier, Northwestern Ontario is known for an array of winter outdoor activities, popularly ice fishing and heading to the ski hill. Now, a petition is gathering thousands of signatures calling for ski hills across Ontario to open. And, well, the petition, it does state that skiing should be the safest sport to participate in at this time, and it also stresses the benefits for mental health. A lot of ski hills are struggling. Is there any consideration to open the slopes during the lockdown, or even those in the northern region where there are considerably less cases?
Well, we can look at that, and again, I'll have to take the advice from the health table. But I can't stress this enough. Even up for the great people of Kenora and up in the northern regions, my friends, this is serious. What I wouldn't want to see is people in the hot zones. There's a lot of skiers, snowboarders here that would travel up there to get away, go stay in the hotel, have some meals, and so on and so forth. We need to avoid traveling. You know, and by the way, folks, when this is over, I encourage everyone to go visit Kenora. It's one of the most beautiful places we have in our province. But right now, we have to hunker down. I just can't stress this enough. When you see the modeling, it's going to be a real wake-up call. And as Dr. Yaffe said, they're actually scary numbers. This is crunch time right now. And honestly, the last thing that's on my mind right now are the ski hills. I understand it's great mental health. You're up there, go, maybe cross-country skiing with a family member. Get outdoors. I agree, mental health's an issue, but health overall is so important right now, and not to overload the system. And I've been up there. I've seen the medical. The hospitals up there. They won't be able to handle it if it starts heading up there the way it's heading down here. But thank you for the question.
Follow up.
Thank you, Premier. And it's not only ski hills struggling. A lot of local businesses, of course, in our communities here in Northwestern Ontario rely on tourism to keep afloat, and they are in a huge financial backpedal. Yeah. I was speaking with Kenora MPP Greg Rickford this morning, and he mentioned a plan in regards to helping with their taxes and their energy bills. Yeah. What other steps is the province looking to take to help our local retailers?
Well, something, I have to give a plug to Minister Rickford. He's an absolute champion up there, and I wish everyone in the North could see how he stands up for the people in the North at our cabinet. He's a very loud voice and well-respected cabinet minister. In saying that, one of the areas that people, I encourage, please take us up on the offer of the $10,000 to $20,000 grant to help you. Also, as I'm sure he mentioned to you, the federal government has rent relief for anyone up to 90%. The rent will be taken care of. Up to 65% of the employees' wages will be taken care of. Another package that the province has will be taking care of your taxes, any overhead, be it your heating bills for your businesses and electricity cost. We're trying to take care of all the overhead to help people keep going, but I encourage you, please take us up on the offer. I'm going to give you one example, and these numbers might have changed, but a few days back they gave me numbers. We have a bundle. It's about $660 million that are taking care of people's overhead and their taxes, electricity costs, and everything. Out of $660 million, I think, and it could have changed, but there's only been $11 million of take up on this. Folks, please take us up on the offer. There's $660 million sitting there for small businesses. Please take us up on the offer. There just hasn't been an uptick. And then the forms are easy. There's, just fill them out, send them in, and we're good to go. But I'm just not seeing the uptick and I've asked for the numbers, how many people have taken us up on the $10,000 to $20,000 grant. Take us up on it. This will help you get through. Folks, at the end of the day, as soon as we get the vaccines, we're going to be vaccinating everyone in Ontario in the healthcare sector, emergency service, so on and so forth. But we're going to do mass vaccinations. We have to hang in there till April. April, May, and June. We're hoping we'll get 5 million doses every single month. We'll be vaccinating. These are staggering numbers. 160,000 people a day across the province, but we have to get to that point, and it's going to be one heck of a bumpy road. I'm being very frank with the people. Everyone's been together, all of us from the beginning. We're going to stick together, and we just have to get through these next few months, and then we can get everyone vaccinated.
Last question.
From Sean Jeffords at Canadian Press.
Hi, Sean.
Good afternoon, Premier. Perhaps a question for both you and Minister Lecce,
Sure.
specifically on schools.
Sure.
So looking at the announcement yesterday, there's some funding from the federal government that's been put aside to buy devices for school boards to distribute to families and students. I think a lot of families are going to look at that and wonder why that money is not being put into initiatives that would keep students in class, in school, such as hiring more teachers, even on a temporary basis, to lower class sizes. Why is the government not considering that?
Well, we actually are, and I'll pass this over to Minister Lecce.
Yeah, it's actually not an either or proposition. We can do both. We can stand up and strengthen our online learning program, which right now is the default we need to rely on, while the medical experts have said kids should stay home given that spike in positivity, spike in case numbers of youth over the holidays. In addition, we have invested over $1.3 billion to date, and a commitment, as I noted earlier, of another $380 million principally for the very priorities you've suggested, things that can help from an infection prevention perspective, actions that could help mitigate the spread within our schools. So far, our plan has enabled kids to go to school, 1.5 million children from September to December, with a plan that really leads the nation in the comprehensive nature of it. I recognize, obviously, there's a rising level of transmission in the community. There's a rising threat to our province. And therefore, our government believes well before today or this week or the decision we made yesterday, we've got to continue to scale up our plan as we have since March to the present. That's why we're going to be putting more monies in province-wide targeted surveillance testing, that asymptomatic expansion. That's why we're allocating additional monies for air ventilation, for cleaning, and for teachers. I will note in this province, unlike virtually any other that I'm cognizant of, we have over 3,000 net new teachers in school boards, especially here in the GTHA, in any community with high risk. The school boards, because of our funding, in part, have reduced class averages well below the provincial average. Jeff, you don't just have 3,000 more teachers. You don't have, 600 more public health nurses, 1,300 more custodians by chance. That happened as a direct result of the investments we put in to prioritize health and safety of kids. And we'll continue to do that with the monies we're unlocking and investing in before school students can return to class. That's our commitment. We want to get these kids back. We want to do so in a safe, but every step of the way we followed expert advice and we've invested the dollars required to enable kids to learn safely.
Follow up?
And Premier, I wanted to ask you about the warnings you're issuing today, the requests you're making, very impassioned to have people follow public health rules. Mm-hmm. Now, I'm wondering if you think that, or what you would say really to people who look at the actions of former Minister Phillips, who did not follow the same public health guidelines, a member of your government, who then say your government has lost the moral authority to make these requests, who are frustrated and say, frankly, if they're not following the rules, why should I? What would you say to those people?
Well, I think we addressed that very clearly. It was decisive. We took action. Mr. Phillips has been held accountable. It's unfortunate. The whole situation is taken, but I can assure you, we're steadfast on focusing on making sure we get the vaccines, making sure people follow the protocols. We're steadfast with all our MPPs down here, and we aren't going to waver. We're going to make sure that people are held accountable, and that, I don't care who it is, as I've proven. We need to stick together. We need to follow the protocols, and we'll get through this. But folks, please, again, stay at home. When you can, outside of doctor's appointments, going to get groceries. And I just can't stress this enough. I've never stressed this so much, all the way going back to March, than now. We are in a crisis. That's how I can describe it. It is scary, and we need to work together. We have the best hospitals. We have the best public health units. We have the best people in the province anywhere in North America. When we ramp up, no matter if it's testing or PPEs or doing the vaccinations, we all pull together. But if the average person is not listening, it doesn't matter if we have the best hospitals, best docs, best system, best anything. If you aren't listening, this is going to continue getting out of control. Please just follow the protocols. I can't stress it enough. And I just want to wish everyone a safe weekend. We will get through this. We will stick together, and we'll get through this. But just we need to hang in there till April, May, June. Those are the crunch months that we'll be able to do mass vaccination. So thank you.
Thanks, everyone.
Thank you, everyone. God bless you.